Hello lovely moms, welcome back to the channel Two Hearts. If you're a new mom, an expecting mom, or someone supporting a breastfeeding mother, take a deep breath and settle in. You're doing an amazing job, even on the days when it doesn't feel like it. Today we're talking about a topic that worries many new mothers, especially in those early newborn days, breastfeeding and baby hiccups. If you've ever been feeding your baby and suddenly noticed tiny hiccups starting, or if your baby seems to hiccup all the time, you are definitely not alone. Let's gently talk through what's normal, what causes hiccups, and how you can help your baby feel more comfortable. First, let me reassure you right away, baby hiccups are very common, and in most cases, completely harmless. They are usually not painful and don't mean you're doing anything wrong while breastfeeding. So, what exactly are hiccups? Hiccups happen when the diaphragm, the muscle under the lungs that helps with breathing, suddenly tightens. This causes that little, hic, sound we all recognize. In newborns, the diaphragm is still developing, so it can react more easily. That's why babies hiccup more often than adults. Now let's talk about how breastfeeding connects to hiccups. Many moms notice hiccups during or after a feed. One common reason is swallowing air. When a baby feeds, especially if the latch isn't perfect yet, they may take in small amounts of air along with milk. That air can irritate the diaphragm and trigger hiccups. Another reason is a fast milk flow, which is very common in the early weeks. If your milk lets down quickly, your baby might gulp to keep up. Gulping can lead to more air swallowing and, you guessed it, hiccups. Sometimes hiccups happen simply because your baby's stomach is full. A full tummy can gently press against the diaphragm, causing those tiny spasms. This doesn't mean you overfed your baby. Breastfed babies are very good at regulating their intake. You might also notice hiccups if your baby feeds when they are very hungry or crying hard. Crying can cause them to swallow air even before the feeding starts. Now here's an important question many moms ask. Should I stop breastfeeding if my baby gets hiccups? In most cases, the answer is no. If your baby seems calm, comfortable, and continues feeding well, it's perfectly okay to continue breastfeeding. Hiccups usually don't bother babies the way they bother adults. However, if your baby seems uncomfortable, pulls off the breast, arches their back, or gets fussy, you can gently pause and try a few simple steps. One helpful tip is burping your baby. Even breastfed babies benefit from burping. Try holding your baby upright against your chest and gently pat or rub their back. Sometimes releasing a little trapped air is all it takes. Another gentle approach is changing feeding positions. Keeping your baby a bit more upright during feeds can help reduce air intake. Positions like laid-back breastfeeding or a more upright cradle hold may help if you have a fast letdown. Paying attention to the latch is also important. A deep, comfortable latch helps your baby get milk more efficiently and reduces air swallowing. If breastfeeding is painful for you, or if you hear clicking sounds during feeds, those can be signs of a shallow latch. Getting support from a lactation consultant can make a big difference. If you're pumping and bottle feeding breast milk, hiccups can still happen. In that case, make sure the bottle nipple flow is slow enough for a newborn. Feeding too quickly from a fast flow nipple can cause gulping and air intake. Many moms also wonder if they should give water to stop hiccups. For newborns, breast milk is all they need. You don't need to give water, sugar water, or any home remedies. Breast milk itself is soothing and helps regulate your baby's digestion. Another question that often comes up is whether hiccups mean reflux. Occasional hiccups alone do not mean reflux. If your baby is gaining weight well, seems mostly content, and feeds normally, hiccups are usually just a normal newborn thing. If you notice frequent vomiting, poor weight gain, or extreme fussiness, that's when it's a good idea to speak with a healthcare professional. Let's also talk about moms for a moment. Seeing your baby hiccup can make you anxious, especially when you're already tired and adjusting to motherhood. Please remember this, you are not causing harm to your baby. Breastfeeding is natural, nurturing, and incredibly beneficial, even when hiccups show up. Try to trust your instincts. If your baby looks comfortable, breathes normally, and settles easily, you're doing great. Sometimes the best thing you can do is hold your baby close, offer the breast if they want it, and let their little body figure things out. As your baby grows, hiccups usually become less frequent. Their digestive system matures, feeding becomes more efficient, and those tiny hic moments slowly fade away. Before we wrap up, here's a gentle reminder: every baby is different, and every breastfeeding journey is unique. What matters most is that you and your baby are supported, loved, and cared for. If you found this video helpful or reassuring, please give it a thumbs up. Share your experiences in the comments. Do your babies get hiccups during or after feeds? Your story might help another mom feel less alone. And don't forget to subscribe to the channel for more warm, supportive content on breastfeeding, newborn care, and mother's health.